Welcome to Rwanda Medical Academy. Ever find yourself in a critical situation needing to manage acute severe asthma? It's a scenario that demands urgent and appropriate action. Asthma, in its acute severe form, can escalate rapidly, making every second and every decision matter. It's a dance that requires finesse, knowing the right steps, and executing them in rhythm with the patient's needs. The management of acute severe asthma involves a stepwise approach. It starts with an assessment, understanding the severity of the condition based on clinical signs and objective measures. Then comes oxygen therapy to ensure proper oxygen saturation. Next, we have bronchodilator therapy to relieve bronchoconstriction, followed by systemic corticosteroids to reduce inflammation. And finally, we monitor the patient to gauge their response to the interventions. This dance, when performed correctly, can help prevent a serious asthma attack from becoming a full-blown medical emergency. Remember, early intervention can be the difference between a quick recovery and a medical emergency. Assessment is the first step in managing acute severe asthma. It's a blend of observing clinical signs and symptoms and applying objective measures to gauge the severity of the condition. Now, we won't delve into common indicators of acute severe asthma in this video, as they're covered extensively in another course. The assessment process begins with monitoring vital signs. This includes evaluating oxygen saturation using pulse oximetry, recording heart and respiratory rates, checking blood pressure, and noting body temperature. These steps help us keep tabs on the patient's physiological status, identify signs of distress, and gauge the response to interventions. In severe cases, arterial blood gases, or ABGs, may be required. A blood sample is taken to measure levels of oxygen and carbon dioxide as well as pH. This helps us assess the adequacy of gas exchange in the lungs and the severity of respiratory acidosis or alkalosis. Thorough assessment provides the foundation for successful intervention. Now, let's delve into the "oh shit" mnemonic as a guide to manage acute severe asthma. This catchy memory aid stands for oxygen, SABA or short-acting beta agonist, hydrocortisone, ipratropium bromide, and theophylline, which are key components in the management of this condition. Let's break down the first two components. O stands for oxygen. The objective here is to administer oxygen to maintain oxygen saturation levels above 90%. Oxygen therapy provides an adequate supply of oxygen to the patient using high-flow oxygen delivery systems like a non-rebreather mask. In severe cases, you might consider high-flow nasal cannula or even non-invasive positive pressure ventilation. Next, we have S, which stands for SABA or short-acting beta agonist, also known as salbutamol. The objective here is to relieve bronchoconstriction. You would use a nebulized or metered dose inhaler SABA, such as albuterol, to help open up the airways and improve breathing. Administering salbutamol at a high dose of 5 milligrams via an oxygen-driven nebulizer allows for a rapid onset of action and effectively delivers the medication to the lower airways. These first two steps, oxygen and SABA, are crucial in managing acute severe asthma. They ensure that the patient receives an adequate supply of oxygen and help open up the airways to improve breathing. Oxygen and SABA are crucial first steps in managing acute severe asthma. Let's continue with the "oh shit" mnemonic to manage acute severe asthma. Next in line is the letter H, which stands for hydrocortisone or prednisolone. These systemic corticosteroids play a pivotal role in reducing airway inflammation. By administering either hydrocortisone or prednisolone, we address the underlying inflammation in the airways, a crucial step in decreasing inflammation and preventing relapse. Moving on to I for ipratropium bromide. This is an anticholinergic that may be added to enhance bronchodilation, especially in life-threatening situations. When combined with a short-acting beta agonist, ipratropium bromide can provide additional bronchodilator effects. Administered via a nebulizer, it works to open up the airways by inhibiting bronchoconstriction. Last but not least, we have T for theophylline, or preferably aminophylline. These are considered in life-threatening cases when additional bronchodilation is needed. Theophylline is a bronchodilator that belongs to the class of methylxanthines. It helps relax the smooth muscles of the airways, leading to bronchodilation. Aminophylline, on the other hand, is a water-soluble form of theophylline. It is often used intravenously in emergency situations due to its faster onset of action compared to oral theophylline. Theophylline or aminophylline may be considered if the response to initial bronchodilator therapy is inadequate, especially in severe cases. Hydrocortisone, ipratropium bromide, and theophylline are the next steps in managing acute severe asthma. Let's quickly revisit what we've learned. Management of acute severe asthma requires a timely and strategic approach, starting with a thorough assessment and followed by precise interventions. The "oh shit" mnemonic serves as a useful guide. Oxygen therapy, short-acting beta agonists, hydrocortisone, ipratropium bromide, and theophylline each play a vital role in alleviating symptoms and improving patient outcomes. With these steps, you're now equipped to manage acute severe asthma effectively. Remember, every second counts. Thank you for learning. At Rwanda Medical Academy, knowledge is power and value.